Ahoy hoy! Welcome back to my channel. It's been 2 weeks, but I figured today I'd give you guys an update and give you guys some information. I know some people are probably curious about my thoughts about how Sweden's been covering COVID-19, as well as just know how I'm doing and all. So let me just start by saying this. When it's the summertime, or there's a break where the kids would be off, there's going to be a huge chance I'm not going to make a lot of videos. Because, first of all, it's hard to make videos when the kids are around. And I'm not a channel that has my kids on my videos. I would like to wait for them to be a little bit more older before I start putting them in my videos. I want them to have a clear understanding what stranger danger is first. And yeah, I'm just one of these people that's paranoid about who sees my kids. I know I could always make videos that are for I think I can make them for subscribers only, but I'm not sure. I know you can privatize it, and I know you can have it be seen by certain people, but that's just too much. And I do that enough on my Facebook where only my friend list can see my kids and stuff. So I'm very protective over my kids' privacy and stuff. And also, even when my significant other is here, he can interrupt me at times. So he's currently going back to college, so it's going to be good for the next couple months to make videos because I have a lot of privacy. And not to mention, too, my significant other doesn't want to be in vids. He doesn't like to be photographed. He doesn't like to be videotaped. So that's another major reason why I don't like to make vids when he's around. So yeah. So expect less videos or no videos during the summertime. And when there's a break, although that doesn't seem to correlate with other people taking their breaks either when it comes to schools. So having said that, obviously my kids and my significant other are at school right now. And you all are probably wondering, I know I gave some thoughts about COVID-19 at the start of the pandemic, but that was back in March, nearly 5 months ago. And, I mean, I figure you guys can have my thoughts about it. And I think in a way it might help too, because I do study history and I do study disasters. And while COVID-19 is technically a pandemic, it could be seen as a disaster too in its own way, like a bio-disaster, which is why I think of pandemics anyway. So, despite not locking down, our cases and our deaths are beginning to dwindle. Now, I know we do have a fairly high death toll, but at the start of the pandemic, it was Sweden was ranked 14th, at least on WorldoMeter. And I trust WorldoMeter for the most part because that they're getting their information from Sweden's public health agency site, as well as other government health organizations around the world. And yeah, I know I should not fully put my trust in the government, but the government websites are usually meant to be informational rather than persuasive. Although I guess it depends what government that country, it depends what kind of government is from a certain country. But with Sweden, I trust Sweden's government. Like a lot of Swedes do. And like I said, in the start of the pandemic, especially into April, Sweden's death toll was high. And so it's high compared to other countries. But 5 months into it, Sweden is at least 35 ranked with total cases, and it is 24th or 25th ranked with total deaths. So they have dropped among the highest death tolls in the world greatly in the last few months. And I think some people think it's herd immunity, but I think it's because we've been exposed to the virus the whole time and whatnot, and all this other stuff. And people are probably wondering, how do I feel about the approach that Sweden did, or as well as other things? The thing that kind of annoys me, and here's the thing, it was originally on Sweden's Public Health Agency site. It's not there anymore. But initially, in the start of the pandemic, like in March and April, they said they did this approach because they didn't want a repeat of what happened with the 1918 Spanish flu. And yeah, I know the Spanish flu and COVID-19 are not exactly the same virus, but bear in mind, in 1918, the Spanish flu was a new virus too. And so I guess they wanted to see how Sweden fared during that pandemic. And they saw that the death toll was higher with the second and third wave than it was with the first. Because back then they did quarantine and stuff, just like the U.S. did, as well as other countries. And they decided to approach it differently because they didn't want to have a second and third wave. Yes, the downside would be that the first wave would have a lot more deaths compared to other countries' first waves, but then from that locking down, the second and third waves that other countries would experience would start to climb higher than Sweden's death toll, just like I thought it would. And is that a right move? For this virus, I would say it was. But did it work in the long term? It's going to take a few years to even know if it worked in the long term. I mean, because even though the virus has been around technically since late last year, we still don't know how it really works 100%. So until we get a full handle of how the virus works, it's going to be a while before we can really say, oh, Sweden did it right or Sweden did it wrong or whatnot. I mean, they approached it because they didn't want a repeat from the 1918 pandemic. And in a way, it does seem to be paying off. Sweden's death rate, or not death rate, but the deaths per day are beginning to drop. They're less than 10 now per day. And sometimes you don't even have a death. Their new cases are also dropping. And I think at this point, the attitude in Sweden is just generally people are over it. Here's the thing that I don't think people understand about Swedes. If you ever watched How to Train Your Dragon and you know they have this come at me bro attitude, that's how Swedes are for the most part. They're not a fearful bunch. They don't act on fear. And from someone who does study disasters, I do think that's a wise approach to handle things. You don't want to do things based on fear. You don't think clearly when you're in fear or you're panicking. And when you study a lot of disasters like I do, you see a pattern. And when people act on fear or they panic, that's when things usually start to get worse. Now, as for me, since I am American, although I am, and that's another thing I kind of want to update you guys on, I'm a naturalized Swede now. I got my citizenship back in May, I think. And I do admit I was afraid initially. I was a little shocked about them meaning to keep schools open and all this other stuff, but I looked into the reasoning because they didn't find any evidence. And here's the thing about Swedes, too. They rely heavily on science and statistics. And they just saw other places and how they were handling lockdowns and all this other stuff, and they just realized that there was no scientific evidence to really back up that keeping kids home would really work. Plus, it's not just how they would do with the virus. It's also because a lot of kids that are in school here are also kids of people who are working, and some of those people are essential workers. So those kids can't afford to stay home. And plus in Sweden, there hasn't, as far as I know, and as far as the Public Health Agency has been reporting, there's been no deaths among kids related to COVID-19. That is just the virus. Now, there may have been some kids that have had an underlying issue, and that was listed as the cause of death that was made worse by COVID-19. But as far as COVID-19, there hasn't really been much deaths here related to kids. Most of our deaths have been the elderly, and the top ophthalmologist in Sweden did admit on the Daily Show to Trevor Noah that they didn't anticipate a lot of elderly people dying. That did take them back. But then again, I've been hearing a lot of Swedes say that the care systems had some loopholes before all this started, and the pandemic basically exposed it more. Now, from what I know, care homes were locked down, but a lot of care workers weren't taking the proper precautions, and they transmitted it that way. So that wasn't really put into consideration when they did what they did in Sweden. But like I said, a lot of people were also not surprised because the care system did have some issues. I mean, and the care system here does have issues like it does in the States, but I think it's worse in the U.S. than it is here. But there's still issues here, too. And masks were never really enforced. They didn't really think masks would really do anything. All they just said is socially distance. You know, there's markers on the floors at the stores to say where to stand. There's shields in front of the cashiers. There's hand sanitizer every single place you go to. But I think that method works for Sweden. Because the people here seem to be socially distant anyway. I mean, bear in mind when the virus first came out, it was in the middle of winter, and Swedes usually shack up a lot during the winter time because the winters are very cold. There's usually a lot of snow. We didn't get much snow in this part of Sweden. This past winter it was mild. But you have the long hours of darkness. Here, where I live, we get sunlight for only 6 hours out of a 24-hour day. But believe me, it's worse the more you go north. Like in Corona, I'm probably pronouncing that really, really wrong. Ironically, it almost sounds like Corona, but I'm sure I'm saying it really wrong. Sharona, or it's the most northernest town in Sweden. That starts with a K. And it's spelled Kiruna. So for any Swedes watching me, that's what I'm trying to pronounce. And I'm failing miserably. But anyway, they get the 24 hours of darkness there rather than here. But we still get long hours of darkness. And being around that much darkness, especially if you're an immigrant, is a toll on your body. It messes with your circadian rhythms and all this other stuff. So most people are not out and about during that time anyway, unless it's maybe Christmas or something. But like I said, this struck in the middle of winter after Christmas, so. And they seem to be people that we don't hug and kiss each other when we first see each other. We just go, hi, how are you? And have a brief conversation on all this other stuff. So it's not that we're not friendly, but they tend to socially distance and not greet each other with a handshake or anything like that. So that's another thing, too. Do I think their approach would have worked in the U.S.? Probably not. because we greet people differently in the U.S. We usually greet with each other with a hug or a high five or a handshake or something like that. And a lot of Swedes don't tend to do that here. And I could go into more about how I think how the U.S. is, but I won't. I'll plead the fifth on that since the majority of my audience is from America. But I'll just say it wouldn't. The way that Sweden did it wouldn't work in the U.S. It wouldn't work in other places either, because it's a difference of culture. The Swedes do trust their government a lot more than other countries. They have universal health care, and all this other stuff. Although I do want to point out that despite having universal health care, the Swedes do have a privatized health care for people to use if they don't want their health care to be run by the government. It is slightly more expensive than state-run health care, but you do have that option if you don't want your health care to be under the government. This is a tidbit that most people don't know about Sweden. And also, what people don't realize is that the provinces, the multiplicities or multiplicities or how the fuck you say it, as well as other local governments, they tend to be the ones that control healthcare and run it. Your taxes for healthcare go to those places and not the federal government. The federal government just basically makes regulations and makes sure everybody is not being denied healthcare, whether if you go to state-run or private. And that's another thing, too. Like, the Public Health Agency has their recommendations and their explanations of why they did what they did. But they also let the local and provincial governments also do what they feel like is okay. Case in point, while it's beginning to be believed the virus was here as early as November of 2019, the technical first case and death were both here in this county, which is Jönköping. I don't live in Jönköping. I live closer to Värmland than I do to Jönköping. Jönköping is like an hour away from where I live here, but I still live in Jönköping province or county or wherever you want to call it. And since they were the original epicenter, they did a lot of things to make sure that the spread wasn't going around. Now, while schools remained open, gymnasiums weren't open, and it's hard to do a direct translation of a gymnasium to what we have in the U.S. It's like a combination of the last few years of high school and community college. In fact, my significant other says it's more like a what the fuck did he say it was? Vocational? It's spelled VOCATIONAL, I think. Something like that. That's the kind of thing that the gymnasiums are. They're training you for the job that you want to do. They're training you in the field you want to work in. They're not training you for college. They're training you to see what job you're going to take. And then after that, you go to the universities. And the universities were also closed. So those things were closed because people over 20 can die from the virus. And we have deaths here of someone who were 20 to 29, which is the youngest age group that have had deaths in them. But not to mention, I do want to point out some other things too. The class sizes in Sweden, especially where I live, are small. They're smaller than 20. While they're slightly over than the limit in the U.S., they're still less than what the limit is in Sweden. Still, they say you cannot have a gathering of more than 50 people. That's still true in Sweden. They haven't lowered it or raised it or anything. And if you don't follow what they say, they will shut you down. If you're a business or something else. And the school that my kids go to is a small school, since we're in a village. And, when they had, when they started the school up again last week, they had a meeting outside, and the classes were separated, and the classes were small. I would say there's probably of the order of maybe 1,000 people. Well, let's see. Let me think. There's over 1,000 people living in this village. So, like, I would say close to 1,000. Because there are other people that live in other areas outside of my village that come to this village to go to school and work at the school. So, it's like, let's just say it's a really small number compared to what I'm used to from back home. And I'm from a suburb that's 18 miles outside Washington, D.C. We're about 15, 20 minutes outside of Annapolis and a half hour away from Baltimore. Where I'm from in Maryland is right smack dab between Washington, Annapolis, and Baltimore. So we would have a lot more people there than the village here, especially since the village here is right outside a small town that I think the place where I'm from in America is bigger than. So, yeah. So they have small class sizes, but then again, I remember when we lived in the other county or in the other province of Gotland, and we lived near Burroughs. The daycare classes were also small, so they tend to have small classes here. So they don't have classes of 30 like we do in the U.S. typically. At least if you're in a large city or something like that. Drinky drink. Now do I agree with this approach for Sweden? Considering what they saw during the 1918 pandemic, yes, I do. Do I think this should be used for every single virus outbreak? No. Luckily for COVID-19, it has a very small mortality rate. Not everyone who gets it dies. And while people who have underlying health issues would be very vulnerable to it and could get seriously hurt on it, I know that some people who've had the virus have had health problems afterwards. So it's not exactly a good virus to get, even if it doesn't have a high mortality rate. Now, would we do this, say, on the pneumonic plague? Hell no. Hell no. I say that because even in this day of age, with antibiotics and stuff, and alternatives to antibiotics if you're allergic to penicillin, there is a 100% mortality rate if you get pneumonic plague, even with treatment. Now, there is a difference between mortality rate if you don't get treatment at all and if you do get treatment. Bubonic plague was more deadly when there was no treatment, but if you get treated, you have a better survival rate. And the same thing goes with the I'm probably going to fuck this word up. Septic anemia plague. That's more deadly than the bubonic plague. But even with treatment, you can still survive it, although the chances are less. With pneumonic plague, there's no survival rate, even if you do get treatment. You're fucked once you get it. And let me just add that don't underestimate bubonic plague just because there's antibiotics to treat it. Because if you don't get it treated, it can turn into pneumonic plague, and that's when we're all fucked. Because like I said, there's no treatment for that. Even after all these years, and I think the first plague happened, what was it, 700 years ago? No, it had to be more than that. But put it this way, the plagues have been around for centuries. And while there's more better treatment for bubonic and septic anemia, there's none for pneumonic in this day and age. So if you get that, you're fucked. Which is why I think if you would approach that kind of plague with what Sweden did, it wouldn't work. It will not work. I probably fear that virus more than anything else, even though it's rare these days. But I know there's been some stories about the bubonic plague resurfacing once again. And while it's not something to be feared like it was, say, centuries ago, I would still be very careful, because if you don't get that shit treated, that can turn into pneumonic plague, and that is the deadlier of the three. So yeah. And I also want to add too, my daughter was in daycare at the start of the pandemic. She went up to my son's school now, because she'll be 6 in November. And when she was still in daycare, and they were also open other than my son's school, they had the kids go home for 2 weeks who were there for free and had a parent home, which is what my daughter had. I was home and she was there for free, because a kid can be at daycare here in Sweden for 15 hours for free if you're going through the state-run daycare. And like with healthcare, there are privatized daycares here. But with state-run, if your kids is only there for 15 hours, it's for free. If your kid's there for special needs, like my daughter is, she's there for free. But if it's more than 15 hours and your parents are both working, you did stay at daycare during that time, but the kids that were there for free were sent home, and they stayed home for 2 weeks. And when she was home for 2 weeks, I self-isolated during that time. Although I self-isolated other times too, so even if we didn't have a mandatory lockdown and stuff, I still self-isolated, because I do have asthma. And sometimes it's kind of hard to tell if it's an asthmatic symptom or it's something else. That was a struggle I had to do when I was first diagnosed with it in 2017. If it was a cold, allergies, or something else. And and allergies do impact asthma a lot. And the thing is, when the virus first started happening, they said, oh, if you have shortness of breath, if you are coughing or you have a fever, you could very well have COVID-19. And of course, we know now that there's more symptoms than that with COVID-19. But at the time, I had 2 of those symptoms. But those 2 symptoms are also the same symptoms with asthma. Now, I do suspect that I may have had COVID-19 at the start of this year, after I got back from the U.S., because the day that I returned from Sweden, from the U.S., was the very same day that the Chinese government came out saying they were having a problem with COVID. And guess who spent 6 hours at the Copenhagen airport that day? Yeah. Now, the reason why I suspected it, because I was coughing a lot more, I was congested more, and yes, the thing is, I did automatically pass off my asthma being an asshole, because that's what I'm going to think whenever I have shortness of breath and coughing a lot. But I just felt a little weird after that. But I never went to the doctor because it didn't get that bad for me. I treated it with my inhalers, thinking it was asthma, and made sure I drank fluids and did what I can whenever my asthma is acting up, or I'm getting one of the nasty sickies like pneumonia or bronchitis. I did self-isolate for at least a week, especially since my kids are not in school at that point, so I was able to stay home for a week and not go anywhere, because oh god, having social anxiety, even if it's mild, takes a lot out of me. Since I was at the airport for 6 hours the day before, I feel like I didn't need to leave the house for a week. So, But then again, I self-isolate anyway whenever my asthma acts up or whenever I have a sicky, like bronchitis. I mean, I know before I didn't leave the house for like a month when I had bronchitis because I was afraid of giving it to other people. And even when my asthma is acting up, I don't go out much only because I'm afraid that even if it's asthma for me, it might be something else to somebody else. So I try to be responsible with that. So, yeah. Let me think if there's anything else to add. I don't know. I mean, if there's something you're curious about, let me know in the comments and all. So I think that's enough for how Sweden is handling COVID and how I think they're handling COVID and all this other stuff. So as I said, the kids are back in school and my significant other is going back to school. I'm trying to remember if I ever told you guys that I'm currently in a neurological investigation to see if I have Asperger's. Now, there was a basic investigation that I had earlier in this year. It wasn't that early. It was probably like May, June kind of thing. And let me just point out, when you go to the doctor's chair for appointments like that, they make sure to tell you that if you're coughing and having a fever or you feel shortness of breath, you should stay home. So, but I didn't have those problems, even if I was asthmatic. But like I said, I have mild asthma, and my asthma is usually an asshole to me at nighttime anyway when I'm trying to sleep. Not always, but sometimes, but most of the time that's when it strikes. So anyway, as I was saying, I'm doing a basic, or it's not basic anymore. I'm about to go into the full nitty gritty, but the basic neurological investigation I was in concluded that they suspect I'm on the autistic spectrum, or I have an autistic spectrum disorder. When I contacted them, I said that I think I have Asperger's syndrome. Now, the thing about Asperger's syndrome, especially if it's really high functioning, is that it's something that doesn't need a diagnosis, because you usually grow out of it, or you learn to adapt and coexist with it. It's not something that you feel like hinders your life to the point where you need medical intervention, or that you need that much help with dealing, because it's high functioning. But the reason why I decided to get investigated for it is because I see a lot of my behavior in my daughter now. She has a lot of my behavior, and she's also suspected on being on the spectrum as well. And I mainly did it because I want to help her, because I'm understanding where she's going through. Even though it's a little bit different, like, despite having it, I think she's more sociable than I am. People think that we all suffer the same way, and we don't. Just between me and my daughter, I feel like the socializing bit is the worst compared to her. She has no trouble going up to people. She has no trouble opening up. She doesn't cry much when I leave her, although she will cry sometimes, but not as bad as I did. I mean, put it this way, I was so bad that my mom and dad never put me in preschool. I went to daycare, but I never went to nursery school and preschool because my separation anxiety with them and my social anxiety was that bad. Now, what I find funny today when I think back on it is that I thought back then I was a sociable person. But then again, I think sociable is just saying hi to somebody and smiling at them and waving at them. And apparently it's not. I remember the first time I went to preschool. And Mom says I was about 2-3 years old. She left me and I cried for like 2 hours. The only time I didn't cry was when I was doing music and painting. And then once I was done with that, and also I don't recall crying when I was on the I remember some aspects of it. I don't remember all of it, but I remember some aspects of it. I do remember crying a lot, hiding underneath the table, which I did a lot whenever my parents dropped me off somewhere. I didn't try to go play with kids. I was a bit shy to start a conversation and all. But the only times that I was relaxed was when I was playing on the playground equipment, and I was playing with music, when I was doing art. So that's the only time I didn't cry. And my daughter doesn't have that problem as bad as I did. Now, what she did have when she was younger, when she was an infant, was separation anxiety. But I'll go into that like another time. But we are different in some areas, even though we are both considered to be on the spectrum. But for me, I had to go ahead to get investigated more, to get into the nitty-gritty, to see where I lay on the spectrum. And my daughter right now, her psychologist figured it's, at this time, it's not to do that, because they want to give her some time to grow out of whatever problem she's having. I'm not saying to grow out of anything on the spectrum. I'm just saying there's habits that you tend to grow out of, and they're waiting to see if she does that. Because sometimes she can advance within a year. So, and plus she's still young. Me, I'm a lost cause at age 38 and all this other stuff. So, they're more interested in looking into some stuff. And I don't want to go into some details about why they want to look into me more. Let's see. So, the last year has been hard. I know I haven't gone through all the people who have died, mainly because it wasn't ready to be talked about. And I'm not going to go into the nitty-gritty stuff, but in the last year I've had, let's see, including this year too, other than last year. I want to say I had 13 people I know die. 4 people were from this year, and the rest of them were from last year. As you guys remember, I made a video about Lucy, my friend that died from cancer last February. My grandma, my nana, my mom's mom, she died in April last year from complications of COPD, which is a really bad respiratory disorder or illness you can get. It's worse than asthma. Way worse than asthma. My uncle died 2 weeks after that from a brain tumor. Let's see, that's in May. In July, I had my best friend's cousin died, who I was friends with. She died from a blood clot or something. Shortly after giving birth, it was 10 days after she gave birth to her daughter. My classmate died from complications of a disorder she had. I don't know what she had exactly, but she was in a wheelchair. Then my step-grandfather died from breathing problems. My grand-aunt died from cancer. My PE teacher died. I forgot what he died from now. I don't mean to laugh at the death. I'm just laughing at my inability to remember what it was. And last but not least from last year, my grandmother, my dad's mom, died in December, a few days before I came back to the States, from natural causes. She was almost 90 and she died in her sleep. Then this year, I lost a classmate in January. I don't know what from still. Then I had a coworker died in June from complications. What was it? It starts with an H. And then I had my step-grandmother die in April from cancer. And then I recently lost another classmate back in earlier this month. So it's been 13 deaths. That's a lot for someone to handle in a short amount of time. And when I saw the psychologist, at least the second one, I made sure I mentioned all those deaths because those are probably factoring into why I'm having depression off and on and all this other stuff. And it's not that I haven't accepted their deaths. It's just like when good memories about them surface, that's when I start getting sad and nostalgic and all this other stuff. So, yeah. It hasn't been a good past year with losing all these people, that's for damn sure. Within a year, I lost basically the rest of my grandparents. My grandfather, my dad's dad, died in 2007 on Christmas Eve. And he had cancer. And my grandfather, my mom's dad, died in 2009. We don't know if he had a stroke or he had a seizure, but something happened when he was eating. And he was eating steak, and it got stuck in his throat, and he choked. And normally when you choke on a piece of food, and I'm speaking from personal experience here, you do this, you get up and you indicate that you're not breathing. With him, one of his friends, he was out to dinner with my step-grandmother and two friends of theirs. And they noticed that he was turning blue. And they tried to get it out of him, and I think they say it took 20 minutes between the friend and some doctors that were there to get it out of his throat. But that was 20 minutes of oxygen deprivation. And he eventually died from complications. Now, we don't know if the stroke really helped or not, but, yeah. So, he basically lost a lot of oxygen and died from that. So, that happened in 2009, if I didn't mention that. So, I'm just trying to figure out if there's anything else I should update you guys on. God, this video is becoming long. My right ankle is still acting up, but it only acts up when I run, which is basically mimicking the other ankle. But I think I did something to it in a different place than the other. Because for a while I wasn't running around much, but then I started running when my daughter started to ride her bicycle, and I would run to keep up with her sometimes, and that's when it would start hurting. My knee acts up occasionally too, but not that bad like it was months ago. I did want to add this, but I think I'm going to make a separate video about that, and I think I'll talk about that a little bit later or next week. That involves my dancing, and my attitude has changed about dancing in the last couple, probably in the last 2 years since I had issues with the left ankle, and I feel like it's bleeding into my TikTok videos a bit. So, but I'll talk about that in another video. Well, if you made it this far, congratulations. You like to hear me ramble and all. So if you like this video, hit like. If you subscribe, I'll be delighted like you wouldn't believe. If you have any questions about what I talked about, go ahead and ask. The worst I can do is not answer them. But yeah. So, and don't hesitate to comment about anything that I said in my video too. Just don't leave asshole-ish comments because I will probably delete them. I used to be a moderator on a message board, so the moderator in me kicks in at times, but I prefer not to do that. Prefer to warn someone to behave themselves before I resort to that. So, yeah. Talk to you all later. Bye-bye.